Let's talk briefly about hand hygiene. You see, the hands have been said to be the most important vehicle in the transmission of infectious agents from one person to another, whether it is in public places or even within the healthcare environment. And healthcare doesn't have to be in the hospital alone. Even in your homes, if you're taking care of a sick child, a sick relative, that is a healthcare environment. Now, on our hands, we have resident flora. That's pathogens that are natively in us. They are more deep-seated within our hands. Those ones may not be easily transmissible. But you see, the ones we pick up when we shake hands, when we touch surfaces, sometimes people sneeze into their hands, sneeze into the environment. When we touch contaminated materials, those ones we readily pick them up. And every time we shake hands, you touch the skin, or you exchange biros or pens or phones from one person to another, unknowingly we are transmitting these diseases. And that's why hand hygiene is very, very important to limit the spread of infections. Now, hand hygiene can be in two forms. First, you have washing of the hands with soap and water, running water, liquid soap under a tap. And it's advised that you do that for 40 seconds to 60 minutes, 60 seconds. That's 1 full minute for proper washing. And hand washing is recommended when there is dirt, visible dirt on your hand, when your hands are visibly soiled. Please wash your hands. But if your hands are not visibly soiled and you think they're still clean, then you can use alcohol-based hand sanitizers, alcohol-based hand drugs. And they must contain up to 60% alcohol for them to be considered effective. And in rubbing your hands or washing your hands, hand rub, by the way, takes from 20 to 30 seconds. That's the minimum time required for effective hand rub. Now, in washing your hands or applying hand sanitizers, it's advised that you start by rubbing your hands together, then curve your hands to make sure that you get the surface of the palms, then interlock your fingers to make sure that you get all those crevices, then clean around the thumbs, clean around the two thumbs, clean around the wrist, then also clean your fingertips to ensure that no part of your hand is left out. WHO also recommends for health workers 5 moments on hand hygiene. You see the posters around and reminders on how to effectively clean our hands. They are everywhere in the hospital. But it's important for us to know that the hands remain the most important agents in transmitting infections, and for us to limit infections, we must wash our hands regularly. Please share this message everywhere. Keep your hands clean and keep your family and friends healthy. Thank you very much.